Hi, my name's Candace Harding. I am a doctor of physical therapy with Loudoun Sports Therapy Center, or otherwise known as LSTC. Today we're meeting together to talk about what physical therapy is, right? It's kind of a broad topic, nobody really knows, so I'm here to demystify. Okay, so I guess at its core, physical therapy is a form of healing arts, if you will, or healthcare that involves the use of tests and measures employed by a physical therapist to help determine how your body is functioning. With that information, we will then prescribe exercises or activities, things that should actually help your body begin to heal. At the end of the day, our biggest concern is how your pain or injury, or it could be something you've been dealing with your entire life. Maybe you were born with one leg longer than the other. But we're really worried about how those things are impacting your daily life. And so one of the first things we ask you is exactly that, and what do you want to get back to doing? Or even if it's something you think you've never been able to do, but it's a pipe dream, it's out there, we still want to know about that because we will work as hard as we can to help you achieve those goals. So at the end of the day, like I said, it could be something you've been dealing with your entire life. So why now? Why would you take the time to come into physical therapy now? The biggest thing is oftentimes the longer a condition has been present, the longer it can potentially take to improve. And there's a lot of research that shows when it comes to things like back pain or knee pain or arthritis, the sooner you come in and begin strengthening and addressing the problem, the sooner you feel better and you likely have much better outcomes in the long term. So you thought you might have to have a surgery for it. Well, guess what? You might not need that surgery anymore. We're not miracle workers. If we can't fix something or help you fix it, we will tell you. But it's better to just be proactive about your health. You take your car into a mechanic every 3,000 miles to get the oil changed, right? So why wouldn't you do the same thing for your body? And so at the end of the day, you're really probably asking, so how do you achieve these wonderful results that you're talking about, Candace? Well, it's really based on an individualized evaluation. So the first time you come in, you meet with one of our physical therapists. They ask you a whole bunch of questions so that they can understand what's important to you. And then we take that information and decide what things we need to look at, whether it be a combination of strength testing or a range of motion testing, how your muscles and joints feel, how your nervous system is functioning. We take all of that information and then we give you a plan that is specific to you. You come back for your follow-up appointments and that plan becomes realized in the form of exercises or cardiovascular training, manual therapy, which most people call massage, but we're not massage therapists, so we call it manual therapy. And so that could include soft tissue work or joint mobilizations, which is just a manual technique directed at joints, so like your elbow or your shoulder. But we keep really good track of how you're progressing, so it's not like we're guessing about anything. You do something, something should improve. It might not happen overnight, but you should start seeing small gains. And I personally think here at LSTC, we do a really good job at highlighting those things for you along the way so you don't lose sight of your bigger vision.